Welcome, everyone. I'm Ashanti Edwards, the Director for Professional Development at the American Society for Cell Biology. We are pleased to offer Online with LSE as part of ASCB's Professional Development webinar series. Today, our facilitator, Mark Barsoum, will be introducing our featured author for this installment of Online with LSE. Mark, you can turn on your camera now.
Thank you, Ashanti. Good afternoon, everyone, or good morning, depending on where you're joining us from. My name is Mark Barsoum. I'm a faculty member in the biology department at Davidson College in North Carolina, and a member of the LSE editorial board. I'm also the co-organizer of the Online with LSE series this year with my fellow editorial board member, Professor Erin Shortledge of Portland State University, who's on the call with us.
Good morning.
Erin and I are very happy to welcome you to this first Online with LSE webinar of the fall, which I have the honor of moderating today. Just to remind everyone in the audience, the goal of this webinar is to be sort of a virtual journal club to provide some behind-the-scenes insights into biology education studies. I also would like to strongly encourage everyone to submit questions as we go. That's what really makes these conversations happen. So please make active use of the Q&A feature to submit your questions. We will synthesize questions as we go and make them visible. Okay, without further ado, it is my pleasure to introduce today's featured author. Logan Gin is a PhD candidate in biology and an NSF graduate research fellow at Arizona State University. Previously, he did his undergraduate work at UNC Chapel Hill. At Arizona State, he's doing his dissertation research in the Brownell and Cooper Biology Education Research Labs, focusing on issues of equity and access in biology education, with a particular focus on disability and mental health. His recent and very important work exploring mental health and support for graduate students was featured just about a week and a half ago in Science, in an interview piece in Science. Today in this webinar, Logan will share with us a closer look behind the scenes of his recent and also very important research on the impact that the transition to online courses as a result of COVID-19 has had on undergraduate STEM students with disabilities. Welcome, Logan. We're very excited to have you today as our featured author.
And thank you, Mark. And I'm also really excited to be here with all of you. And thank you all for taking the time to join us here as we engage in discussion over the next hour or so. So I'm just going to begin by just some a brief overview of our study published in CBE LSE to give you just a bit of background on the study before we take questions here. So as far as overview goes, we know that the COVID-19 pandemic affected all STEM students. And what this meant was many colleges and universities transitioned their in-person instruction to an online format during the spring 2020 term. And due to this rapid shift, we hypothesized that students with disabilities who use accommodations from disability resource centers may have had unique challenges in navigating this shift. And that's because instructors and disability resource centers may have had limited time to prepare or limited time to plan ahead in terms of what was and wasn't appropriate in terms of online accommodation. Yet we do want to also reiterate here that colleges and universities are legally required and mandated to accommodate students in college courses, regardless of whether that instruction is in person or online. So we've thought that this was a very important area of future investigation. So you may be wondering, and I would just like to chat here in terms of who are students with disabilities. And for the purpose of this work, we define students with disabilities as those that are supported by a university's disability resource center or offices on campus that are designed to support students with disabilities. So this can include students with learning disabilities, students with physical disabilities, students with chronic health conditions, students with vision loss, hearing loss, and mental health and psychological disabilities. And I would just like to highlight a really important point here that in order to be registered with the University Disability Resource Center, official documentation is required, such as a medical diagnosis or an evaluation from a medical professional. So in some ways, we may actually be underestimating the total number of students who would be eligible for services from a University Disability Resource Center. And I'd be happy to talk further about this. So for this study, we're interested in the following research questions. First, to what extent were students able to access their previously established accommodations following the transition to online STEM courses due to COVID-19? Secondly, to what extent did the transition to online instruction present unique challenges for STEM students with disabilities, and how, if at all, were these challenges accommodated? And finally, how, if at all, did the transition to online education affect the overall process of being accommodated for students with disabilities? And in terms of methods, we interviewed 66 students with disabilities from 7 different large enrollment institutions, and these were students who were enrolled in at least one STEM course during the spring 2020 term, the term where we transitioned to online. And our interview protocol and our interview script explored the extent to which students with disabilities enrolled in online courses were impacted by this transition to online instruction during COVID-19. And finally, I would just like to highlight a few key findings and results that stuck out to us as part of this work. So the first is that students with disabilities were often unable to access the accommodations that they would have had access to in person. And this can include things like a reduced distraction testing environment, or having additional time on exams, or having note-taking services from the Disability Resource Center. Additionally, the transition to online resulted in novel and unique challenges for students with disabilities that would have likely required additional accommodations on behalf of the Disability Resource Center. So things such as closed caption video lectures, or adapted test proctoring softwares that students were now using as part of their online courses. And finally, and importantly, we uncovered barriers that prevented students from effectively and efficiently receiving accommodations for online instruction. And this was often due to both the instructor and Disability Resource Center. So things such as instructors making determinations about what was and wasn't appropriate in terms of accommodations, and then also the lack of proactive involvement of the DRC about thinking about delivering online accommodations for students, despite being mandated and required to do so, which we uncovered as a particular challenge with all of this work. So before I take any questions, I would just like to acknowledge the research team that helped make this work possible. So this includes my co-advisors, Dr. Caitlin Cooper and Dr. Sarah Brownell, along with Frank Guerrero, who is an undergraduate researcher who contributed to this work. And again, without this team, this work would not be possible, as I'm a representative of the author team here to take questions. So with that, I would be happy to open it up for discussion and really look forward to interacting with all of you.
Thanks, Logan, for that nice overview. Just a reminder to our audience members to go ahead and insert your questions in the Q&A feature in the Q&A box, if you would, so we can get to your questions as soon as possible. I'll kick things off here with sort of a reflective question for you, Logan. Can you give us some insights into your own research transition in this situation where a pandemic hit all of us and changed everything for us in academia so suddenly? As a graduate student, and as a scientist, what was your approach when this occurred, and how did you sort of approach the question of what do I need to do now to deal with this new reality in my graduate work?
Right. Yeah. Thanks for that question, Mark. And I will just say, when I began my graduate program over 4 years ago now, I didn't expect to be navigating a global pandemic as I'm trying to finish my PhD here. But as you said, I've had been able to adapt my research interest as part of the pandemic, and I was able to adapt to to the times that were the COVID-19 pandemic. So traditionally, as I entered my PhD, I didn't necessarily think that online education would be an aspect of my dissertation work, but now this is essentially morphed into a chapter of my dissertation that I'm really excited about because of the challenges and opportunities that online present. So have traditionally kind of been thinking about novel learning environments, starting with some of my work on active learning environments and how we accommodate students with disabilities, some other work on research experiences and undergraduate research experiences for students with disabilities. And then this has just become kind of a third part of that piece in terms of thinking about online education. So I was able to shift and adapt some of the projects that I was thinking about and working on at the time. But when the shift happened, anecdotally, we were hearing that this was challenging for folks. And then we wanted to do an investigation of kind of documenting what was happening during the spring 2020 term. So despite some of my other ongoing work that may have been halted as a result of that, I did have a survey that I was hoping to collect pre and post data from during that spring term that, unfortunately, given the transition, the post data was not necessarily as relevant as it would have been if we would have stayed in person, but I was able to adapt to taking up new studies like this one that we were able to do last spring. And then I actually, and I'll be happy to talk more about that, but we've actually done some follow-up work on thinking about, what does online education look like a year later, a year revisited in the COVID-19 pandemic. So this has really become kind of a staple of my research portfolio, even though I like I said, I didn't necessarily expect that coming into graduate school. So.
Yeah, so important to be adaptable. So we have a question from the audience here. When defining students with disabilities, you mentioned that it was specifically students with documentation, but that this may lead to underestimates. Were you referencing students who are unable to receive documentation? And how do you think you might address or research inequity in this demographic?
Yeah, that's a very important question that I want to certainly highlight. This is a challenge, right? So for this work in particular, we were just including students who were registered with their university's disability resource center. So this means that they were, in the category of students who are legally obligated to having accommodations in their courses. So with that, we do know that there's barriers, both financially, logistically, systematically, in terms of, how do students receive that documentation in terms of being eligible for accommodations. So that's something when I speak about kind of underestimating, there may be folks in our courses essentially with undiagnosed disabilities for one reason or another, that we, as we think about the students who are able to access accommodations, we also need to think critically about the students who are, in our courses experiencing similar disabilities, yet may not necessarily be registered or documented with the Disability Resource Center. So I think this is a really important area, to think critically about and to address with our work is thinking about, the students who are legally required to be accommodated, but then also the students who we may be missing out on as well. So in terms of kind of concrete things, thinking critically about how we design our courses, we can consider all the students of varying identities, along with the ones that are registered and aren't registered, for the best way to design our courses for students. Great,
thank you. Another question from the audience here. Do you have any suggestions on how lab work can be made more real as in quotes, for those hands-on learners and students with disabilities who cannot learn well online? Yeah. Also, what types of accommodations do you recommend for students with learning disabilities for online science courses?
Yeah, so Yeah, so the question about lab courses is an interesting one. And we particularly we're interested in online courses broadly. So actually many students didn't mention lab courses in our interviews enough to kind of have that be a unique theme that students were bringing up, with lab courses being more or less challenging for them. I think this can bring in some kind of interesting implications for delivering a lab online. For example, folks who may have turned to kind of lab simulations or lab videos, or things where students may have been able to engage in a different way in those lab courses. So, for students who may have not been able to fully engage in an in-person lab, maybe they were able to engage more, if not better, in an online lab space. I know, speaking from my own personal experiences with lab courses, I had many physical kind of challenges with lab courses that perhaps, some of these more virtual simulations could have been kind of a more of an immersion kind of learning experience for a student like myself. But that could have been true for other students who may have navigated physical or in-person barriers to lab instruction. So I think that's something that it didn't necessarily come out specific, as a specific theme in our interviews, but could be something that was a potential positive as a result of some of this as well. So.
Great, thank you for that. Another question here, you showed a list of different types of disabilities. Do you know if students with particular disabilities were impacted more than others as a result of the pandemic?
Right, yeah, so yeah, as I listed, the types of disabilities are what disability resource centers commonly encounter and accommodate. So we could potentially speculate, and then there's literature supporting the rise in mental health issues as a result of the COVID-19 pandemic. Things like anxiety and depression were kind of running rampant during these times, and so those might be things that we would think that students are dealing with and encountering, and we see come up in our interviews and as we collect additional data. These are things that are being reported at higher frequencies than what we've seen in the past. Then I do also want to note some of the nuance here, where in some ways students with other types of disabilities may have had differential kind of experiences as a result of the pandemic. So, students who may have had physical disabilities or chronic health conditions that they, were able to, take their instruction from home during certain days when they may have not been feeling too well, or things like that could have actually been kind of an opportunity for some students. So we kind of hesitate a little bit to think about comparing and contrasting disability type and disability specifics, just given our sample sizes and kind of what we're interested in. But we do see that there could be kind of disproportional effects for some subgroups of disabilities.
You had a category for mental health disabilities. Do people with depression and anxiety, for example, consider it to be a disability, and would they still be eligible for services through their DRC?
And again, that's a really important question to consider. Is mental health, depression and anxiety in particular, considered a disability? And the way I'd answer that is one, from the Disability Resource Center side. So from the university's perspective, those would absolutely count as being eligible for services, assuming the student would be able to provide appropriate documentation. But we have ongoing interest in exploring kind of what that looks like on a practical level for students. And if a student identifies as having depression or anxiety, do they consider that a disability? Or are they more or less likely to go seek out services from an office that the name of the office is Disability Resource Center, for example, and if they don't necessarily consider themselves having a disability, would they seek out those resources? There's been some movements kind of on a nationwide level, at a university level, to actually kind of rebrand some of these offices to make them potentially more inclusive of the word disability. So some folks have adopted terms like accessibility resource center or accommodations resource center, things like that. Actually, at my own institution, Arizona State has changed, actually during the pandemic, changed the name from DRC, Disability Resource Center, to SAILS, which is Student Accessible and Inclusive Learning Services, as a potential approach to be more inclusive of other quote unquote kind of types of disabilities that could include things like mental health, depression, anxiety, et cetera. So yeah, so thanks for that question.
An audience member here asks, can you talk a bit about how you think about a social/relational perspective on disability versus a diagnostic or medical perspective as it relates to your research? And also how you navigate these perspectives when working within a discipline and with faculty and reviewers who may be more familiar with a diagnostic view of disability.
Right, and in general, we try to take a social model of disability perspective, which considers that the disability is not the result of a shortcoming of the person, for example, or the person with the disability, but it's actually the system and kind of a systemic problem that is a result of historical kind of biases, discrimination, kind of ableist culture within science, within academia, et cetera. So that's typically the approach that we take. However, there are some real concerns from the medical perspective that are important to consider. But in general, we like to take the approach from the social perspective, because the burden and the responsibility should not be placed on the student, and we really deeply support that this is a social and a systemic kind of problem to address, and not something that students are coming to us. It's a deficit approach, if you will, where there's something wrong with the student, but it's actually we very much think there's things within the system that can be altered and changed to best accommodate and best include a student with disability in science. So yeah.
Great, thank you. Another audience member asks, at our institution, faculty are not informed about the need for accommodations and that they are legally responsible to accommodate all students. Do you know if that's the case at the institutions that you studied, and would you expand on that?
Yeah, that's a important question in terms of faculty knowledge and training on students with disabilities. And there's literature suggesting that faculty receive very little guidance and training on how to, well, first of all, that they are mandated and responsible for providing these accommodations and working with students, but then also kind of on a practical level, kind of what does that look like, and how do they work and interface with both students and the resources that they have on campus to be able to support a student. So that's something that future and ongoing work should definitely address, is the extent to which faculty feel supported and trained to be able to fully accommodate students. But unfortunately, yeah, that's something that we do see at kind of across the board, in terms of individual faculty feeling like they don't necessarily have the knowledge, the skills, the training to support students with disabilities.
Yeah, the support infrastructure is just so important to support all students in these times, especially.
Yeah.
Another student.
And we do realize, yeah, that this was a challenge for everyone, right? It was a challenge for instructors. It was a challenge for Disability Resource Center staff, and it was a challenge for students as well. I think just the unfortunate thing, though, is that much of the burden and the effects were placed onto the student, right? As opposed to potential sanctions or ramifications for instructors who weren't necessarily providing the appropriate accommodations to students, or from the the DRC side, kind of what were the ramifications, since they may have not had the appropriate accommodations to deliver to students. Yet again, like I said, the bulk of the responsibility ended up back on the student, which we again would argue is unacceptable.
Yeah, definitely. Thank you. Another audience member asks, did any of the colleges offer the students with disabilities a redo on the courses where they did not receive adequate accommodations online?
Yeah, I'm unsure what that looked like, given our study, since we were particularly interested in, right during this transition, what was going on and what was happening. So many of the students were already enrolled in those courses, the students that we were hearing from. So we didn't necessarily get insights, what happened at the end of the semester. Were grades adjusted in any way? Were they given, abilities to take replacement courses or additional, courses to make up for the lack of accommodation? So I don't have a exact sense on kind of what that looked like. So I can't necessarily speak to that, but I do know, we were very much interested in what was happening in the moment as we were transitioning these courses.
It would be wonderful if institutions would read your work, for example, and adjust and modify their practices and policies in response.
Yeah, and that's something that we actually don't necessarily know what the longer term ramifications of this will be. Did students encounter a course that they just weren't able to be accommodated in, and end up dropping their courses or withdrawing from courses, or even kind of the possibility of switching majors, or switching out of STEM courses because of such negative experiences during that first transitional term, which all are important things to consider as well. And as they move on, to STEM careers or other careers, it'd be just important to know, that spring 2020 term could have, likely had some impact on their trajectory beyond just the spring 2020 term.
Yeah, for sure. Here's an audience question asking, how flexible would you suggest instructors be with students regarding deadlines for assignments in which timely submission is important for their learning process?
Yeah, and that's a tricky balance, right? Is if there is something in terms of learning outcomes or learning processes that do warrant a stricter deadline, is something to consider. I think I would kind of push towards thinking about designing thinking about our course design in a way, and thinking about are these deadlines absolutely necessary, that it is this really hard and fast deadline, or is there some kind of flexibility that we can incorporate from a design standpoint in terms of thinking about how that would affect student learning throughout the duration of that course. So because I do know certainly that flexible deadlines is something that students reported that they would have benefited from, and some students didn't have. So in the instances where it isn't necessarily vital to that process, incorporating that flexibility seemed to be something that students really would have liked to have had and really would have benefited from. But I do realize that can be challenging depending on kind of what your learning goals and outcomes are for students. So I would, as we continue to think about these things, thinking about what deadlines are essential, what deadlines are, absolutely, hard and fast, and then what ones, do we have some potential for deadline flexibility as we move through a particular course.
Yeah, definitely. I've told my students that unprecedented times call for unprecedented flexibility. So I think that's
I think that's a good approach, Mark. That I would second as well.
So here's a question asking if in your interviews did you detect any attitudinal barriers to providing accommodations, a reluctance perhaps, or a perception that disabled students are viewed as less important or less capable?
Yeah, and unfortunately, yes, we do see that from at least from the student perspective. But speaking about their instructors, where um, some students have reported essentially that um, their instructors were reluctant to providing them accommodations, and some instructors actually made assumptions again about what was and wasn't appropriate for a student, even though, you know, again, kind of coming back to this legal obligation, you know, they're not necessarily the arbiter or the person to be able to make that decision. And if a student requests and is able to receive an accommodation, you know, the instructor isn't necessarily the doesn't have necessarily the power to be able to say, no, you know, I think this accommodation should be more appropriate. We see this with some things like testing, for example. Some folks considered, since, well, all the testing is online, or I made my testing open book exams, or I modified my testing in some way from the instructor side, that it mitigated the need for accommodations for students. Yet students were saying that, no, you know, despite these changes that you're making, I still would like to and have the ability to have access to my accommodations. So that's something that that I think is particularly problematic, where instructors may have been making determinations that they weren't necessarily qualified to be able to make. Which, again, you know, the burden there fell again on the student, because then they had to advocate more than what they usually would to um, convey to the instructor that, you know, they need the accommodation for one particular reason or another, which, you know, is something beyond kind of what should have been necessary in those situations.
Great, thank you. I have a couple questions that I would say are related here. So, you know, one says, I know this wasn't part of your research question, but did you happen to capture instances of the shift to online instruction being helpful for some of your respondents? And another audience member says, basically the same kind of question, did some students with disabilities benefit from online learning? And, you know, with universities switching back now largely to in-person courses, how should universities learn from this rapid shift to online education, and maybe perhaps incorporate some hybrid STEM learning as an accommodation?
Yeah, I totally agree, and I realize much of the manuscript focuses in on the challenges as a result, because overall that is what we saw, is that this was a very challenging time for anyone and everyone involved, but particularly the students with disabilities. Yet there were instances that we were able to capture some of the opportunities and the positive aspects of this transition, and not necessarily the transition, but thinking about how the online medium of instruction could be potentially beneficial for students with disabilities. So some concrete things that come to mind is thinking about you know, opportunities to join remotely to class sessions. You know, if someone was having a particularly challenging day as a result of their disability, you know, you could easily join from the comfort of your home, or in your bed, for example, if you needed to. Other things could be, you know, as you mentioned, Mark, kind of just the inherent um, flexibility that instructors provided. So instead of having an exam that's on a single day that, you know, students have to show up for in class, but having an exam like window where students can take the exam over the course of a few days, or, you know, at a time that works best for them. There were instances that there were opportunities that came up as a result. And the optimist in me would really like to see that these lessons learned, the positive aspects, can become kind of important aspects of our both in-person instruction, but then this hybrid instruction as well. And, you know, can we incorporate the best practices or things that was positive for students as we transition back, and kind of make those things, you know, a staple of how we think about traditional, even in-person instruction, or even hybrid instruction. So yeah, thanks for that question, because, you know, as we transition back, I think these are really important things for us to consider, not only what was challenging, but what were some of the positive aspects that students appreciated and benefited from.
Great, thank you. One audience member says, in my experience, when the shift to online first happened, there was a great emphasis from the department to be understanding and accommodating in general, not just for students with disabilities. Did any students talk about their instructors being more accommodating to their needs as a product of the rapid transition to online?
Yeah, so that was true of many institutions. I think, kind of a greater emphasis on flexibility um, and self-care and things like that during the time of the transition. Yet we uncovered that it didn't necessarily trickle down to the student and their accommodation processes, where many instructors still were, from the perspective of making sure that the instruction was shifted to online, but not necessarily accounting for what the shift of accommodations would look like online. So it was, scrambling to kind of get materials converted to online, use that as a format, as the new format of content delivery. But we unfortunately do not see where that came through to the accommodation process, where students were, essentially, receiving more accommodations, for example, than what they did previously, or being accommodated in a way that they weren't otherwise accommodated before. So, I would say that, yeah, unfortunately, we don't see that instructors were necessarily more accommodating. Because in some ways we just given the lack of standardized accommodations for online learning, in some ways we just, institutions didn't know what those accommodations looked like. As we think about preparation for these shifts, it's important to think about what learning looks like beyond just our traditional in-person learning context.
Great, thank you. One questioner here asks, are there summer schools or internships that specifically ask disabled students to apply? When programs mention people from diverse backgrounds are welcome and do not accept disabled students' applications, are there ways to know if X program or Y internship ever hired disabled students?
Yeah, so kind of a career development question. Yeah, there is a AAAS initiative to look for undergraduate students with disabilities in STEM generally, and place them with interns as interns with future potential employers. So that is something that AAAS has kind of spearheaded, that students with disabilities are encouraged to apply to, because it's specifically for students with disabilities. For some other programs, I can't necessarily speak to programs in general, things like REU programs, for example, if they're considering disability kind of as a identity that would bring diversity to those programs, or if they welcome students and or provide accommodations for students. But this is something very interesting to me, though, in terms of thinking about other learning opportunities that students with disabilities have beyond just the traditional in-person class environment. So, as students are engaging in things like undergraduate research or internships, what does that look like in terms of accommodating students? Because again, coming back to kind of the legality aspect of this, is they are totally entitled to having kind of equal access and equal opportunity to those experiences. So if students are applying to them and not being accepted, that's particularly problematic. But even students who are applying and going through those experiences, we would want to ensure that those students are accessing the accommodations and things that they may need to be fully immersed into those experiences and successful as a result of those. But because we know, the the strength and the impact of these experiences like internships and research experiences on whether or not students want to go into STEM careers. And that's where a lot of the motivation for all of this comes is, how can we recruit and retain as many individuals with disabilities in the scientific workforce as possible, and work to kind of diversify the workforce, adding another layer of diversity being ability status. So that's a really great question, and something that I'm interested in exploring further, in terms of the career pathway for students with disabilities.
Thank you. One audience member is wondering if a medical condition that does not allow you to wear a mask or get a vaccine, wear a mask in class or get a vaccine, is that considered a disability?
Yeah, that's an interesting question. And I'm not exactly sure how to answer it and how the university would respond to a situation like that. But I think it could be, a legitimate concern for someone who would be in that situation. And I don't actually know what necessarily the accommodation would look like for that. Is there a way that they could, join remotely or in a hybrid setting in that course, or how would they, kind of engage in that? I know many universities are offering, and ASU alike has been offering opportunities for students as we're transitioning back to in-person to attend class virtually for health-related concerns and particularly COVID concerns. But so I would think that would be some way for them to still engage in the course in a way that they feel comfortable doing so. But I'm just not exactly sure kind of what that would look like. Again, thinking from the Disability Resource Center side of things, they would need to theoretically be registered with the university for those specific accommodations, but there may be some flexibility built in there, knowing that just in general, we're going to be encountering instances where students might be, be diagnosed with COVID, for example, or be sick and not wanting to attend class on campus. So I hope that answers some of that, but I just am not quite sure what that looks like, on a practical standpoint.
Yeah, that's a tough one, and certainly, obviously, new in our current situation. Something that's never had to be dealt with, at least.
And what I would just encourage, though, is if there are instances like that, from kind of an instructor standpoint, is thinking about being open and willing to discuss what would be most effective for that student, and trying to, and this is one of the challenges that we uncover, though, is trying to open these lines of communication where students would feel comfortable approaching an instructor to discuss that concern, or opening the lines from the instructor to the Disability Resource Center, where they're able to an instructor is able to have support from the Disability Resource Center for a situation like that. And there's just, more communication and open lines of communication between, the student, the instructor, and the Disability Resource Center to navigate some of these, more unique situations, if you will, as students are still, taking some in-person or online courses, but also transitioning back to in-person.
Great, thank you. I have a couple of questions here that are related and sort of future-looking sorts of questions. So one is asking, what is the next research question you'll be investigating? And another is saying, do you see your research becoming a baseline for future studies? Would you want to continue this work and expand it to other aspects regarding disability?
Yeah, so thanks for those questions. In terms of future research questions, we actually do have ongoing work that is taking a look at this essentially 1 year revisited. So we know that this initial study was right during the heart of the transition, where folks were, this rapid transition, folks were, scrambling to move their courses online. Universities were, considering how do they deliver services online, et cetera. Students were navigating what this new novel learning environment looks like. But what we have now is essentially data collected from spring 2021. So almost essentially a year later. And what does that look like for students now, or in this past spring semester? And with that, we want to see, now that we did have a year to potentially proactively plan and develop accommodations or develop our courses for an online format, what does that student experience look like? And unfortunately, we see that many of these issues that students experienced in spring 2020 were still present during spring 2021, despite kind of the additional preparation time that individuals may have had. So I think that's challenging on a number of fronts. Despite having this additional time, was it used to think about students with disabilities? And overwhelmingly, we're seeing that wasn't necessarily the case. But then also, online education isn't necessarily going anywhere. I think COVID has just only highlighted that online education is going to become kind of a staple of what a 21st century college STEM degree is going to look like. So these questions are still extremely relevant and important, and can be kind of broadly relevant to courses that we will continue to think about and develop in the future, because universities, even before COVID, were thinking about formats to incorporate hybrid learning or online learning. I know at ASU, for example, where I am, we actually have a fully online biology degree program that was in existence prior to COVID. Yet the program was up and running without necessarily considering what the differences and needs for accommodations would look like in an fully online curriculum. So that's even potentially more problematic, but students are enrolling in a curriculum that is fully online, but yet they're still trying to develop and consider what ways in which we can fully accommodate our students online. So I think this highlights, as I think the other question says, kind of continuing this research and expanding on it. I think it's totally a ripe and important area for many future studies to really consider how can we make the experience of a student with disability in online learning as accessible and as inclusive as possible.
Great, thank you. I think this may be from the questioner previously about internship programs and hiring. I think it's a follow-up asking, I'm wondering if it's right to just ask if they ever hire disabled students.
I see. Okay, that adds some clarity to that, to the question. Yeah, so I think, it would be interesting in thinking about, again, future studies and future investigations, but thinking about these REU programs or other programs that are specifically designed for undergraduate students to engage in, if, what does representation look like for individuals with disabilities, and potentially surveying or I imagine they would collect some of that data, but it'd be interesting to see, are folks with disabilities being hired at the same rates as, or hired and or able to participate at the same rates as students without disabilities. I have some ongoing work that looks at students with disabilities and their engagement in high impact practices. So things moving, again, even just beyond undergraduate research and internships, but things like seminar courses or writing intensive courses or first year experiences, et cetera. And I'm really just curious, to what extent are students with disabilities participating to the same degree that students with disabilities are not. So I think that's a really important question for us to be asking is, are we even, first of all, providing these opportunities to students with disabilities, but then are we also accepting these students and having these students, participate in many of these experiences that we know can be extremely impactful when it comes to, their ultimate career trajectories and such. So yeah, thanks for clarifying that.
Yeah, thank you for that follow-up question. Okay, we're hitting about 10 minutes of the hour here, and I think we like to end these webinars with sort of a general overview, summary, and lessons learned, some of which you've touched on already in our conversation, but a couple of audience members sort of provided the perfect lead in to this final discussion. So do you think that the pandemic has raised awareness about the need to proactively accommodate students with disabilities? And just overall, what recommendations do you have for instructors and DRCs moving forward? If you can give us just sort of a general lessons learned.
Yeah, absolutely. And I think I would say that this has raised awareness and has started conversations about what does proactive accommodations look like for students with disabilities. And I think in terms of moving forward, what things could look like is multifaceted, but I think there essentially needs to there's layers of things that could potentially happen. I think some of it begins with thinking about DRC structures and how DRCs are providing accommodations for students. I know many of these offices are under-resourced and understaffed in terms of the number of students they're serving and and the number of staff people that they have on board. So thinking about kind of from the university's perspective, where are we putting resources towards supporting students? I know these are big problems to solve, but this is real and legitimate problems that staff folks are saying they're having trouble with. So I think that's kind of a big picture thing to think critically about. How can we continue to provide support for the folks who are in the process of providing accommodations? I think in addition to that, and somewhat in parallel with that, is more work and research needs to be done on kind of what are the best practices and what are evidence-based accommodations for online learning. And much of that just has been non-existent in terms of, do we know that the accommodations that we're providing are fully effective for online education, if we are providing any, right? But the ones that we are providing, making sure that they are they're high quality and evidence-based is one again larger kind of recommendation that I have moving forward. And then more concrete things that I think, those are things that, hopefully, happen as we continue to see the system change and evolve. But I think some more concrete things come back to the idea of the lines of communication. So, are instructors and disability resource centers engaging in some way, that they're sharing information with one another, that they're, instructors are feeling well supported by disability resource centers in terms of how they're working with students with disabilities. Do disability resource centers know what instructors are doing in the class so they can think about how to proactively accommodate students? So having that channel of communication between instructors and DRCs can be really important for both instructors to prepare what it looks like to accommodate and DRCs to look like to prepare kind of what are instructors doing to know what accommodations might look like. And then the final thing I think for instructors is opening those lines of communication with students as well, and making sure that you're from the very beginning of class, being transparent with students about kind of the types of activities they may be encountering or what they may be doing in class, and that there may be a need for more non-traditional accommodations or accommodations that they may need to work more closely with the instructor or the Disability Resource Center in terms of making sure they have what they need to be successful. And then kind of the final layer could be thinking about, this is another bigger picture thing, but thinking about the design of our courses from the instructor side and thinking about how can we design our courses in a way that is most inclusive of all students in our courses, but in particular students with disabilities. And there's a framework that I often reference here with universal design for learning, which considers trying to eliminate as many barriers as possible for everyone. And then by way of that, it also becomes as inclusive as possible for students who may have disabilities and require accommodation. So essentially removes the need, if you will, for accommodations, because we think critically from the design standpoint of how students might encounter a particular curriculum.
Great, thank you. That was a great summary to close off our discussion today. Logan, thank you so much for this really enlightening conversation, and for your really important work, and congratulations to you on all your fantastic work and on your imminent completion of your PhD. We're really excited to see where you go next.
Well, thank you so much. Yeah, I really enjoyed this conversation here. Thank you.
And we do ask those of you in attendance if you could just type in the chat box for us as Logan brings up this slide. As an assessment for us, if you could please use the chat function to write one interesting thing you learned during today's session, that would be really helpful to us. You can go ahead and do that as we close out here these last couple minutes. And also, if you could go forward, Logan, I want to also encourage you to tell us in the chat box if you have ideas for other LSE papers, authors, or topics that you would like to see featured in Online with LSE, which gives us the opportunity to ask you to mark your calendars for our next Online with LSE webinar, which will occur on Friday, October 29th at the same time, noon Eastern. And this will feature author Laura Diaz-Martinez of Gonzaga University, where she will be discussing current approaches for integrating responsible and ethical conduct of research into course-based undergraduate research experiences. So please don't miss that. We hope to see you here for that one. And if you could continue to add to the chat box both one interesting thing you learned from today's session and any suggestions for future topics, we would greatly appreciate that. Thank you all for attending today's webinar, and thank you especially to Logan Gin once again for just a fantastic conversation.